The history of medicine is a fascinating journey through time, revealing how human societies have understood and treated illness from ancient practices to modern advances. In ancient times, medicine was often intertwined with religion and mysticism, as people believed that illness was a result of supernatural forces or disfavor with the gods. Ancient Egyptians, for instance, were pioneers in the medical field. They practiced surgery and developed medicinal compounds, documented extensively in the Ebers Papyrus around 1550 BCE. In ancient Greece, the foundations of Western medicine were laid by figures such as Hippocrates, who is often called the father of medicine. Hippocrates formulated the Hippocratic Oath, which remains a foundational document of medical ethics. His approach was based on the theory of the four humors: blood, phlegm, yellow bile, and black bile, and treatment involved balancing these bodily fluids. His works emphasized a rational and systematic approach to disease diagnosis and care, moving away from supernatural explanations. The Romans further advanced medical knowledge by incorporating Greek medical practices and expanding public health initiatives. They built aqueducts to supply clean water and constructed public baths and hospitals. Galen, a prominent Roman physician, conducted extensive studies on anatomy through animal dissections, which influenced medical understanding for centuries. His texts would dominate European medicine throughout the Middle Ages. During the Middle Ages, much of classical medical knowledge was preserved by Islamic scholars in the Middle East who made significant contributions to medicine. Figures such as Avicenna, who wrote the comprehensive medical text, The Canon of Medicine, influenced both Eastern and Western medical practices. This period also saw the establishment of hospitals that offered care to the sick and poor, a concept that gradually spread to Europe. The Renaissance brought a resurgence of interest in human anatomy and physiology, with advances driven by more systematic dissections of the human body. Physicians like Andreas Vesalius corrected Galenic misconceptions, publishing detailed drawings of the human anatomy. This era also marked the beginning of a more scientific approach to medicine, emphasizing observation and experimentation over traditional dogmas. The 17th and 18th centuries introduced the scientific revolution in medicine, with the development of the microscope by Antony van Leeuwenhoek and the discovery of the circulatory system by William Harvey. These innovations allowed a deeper understanding of the biological processes and structures that underpin human health and disease. During this period, smallpox vaccination was pioneered by Edward Jenner, marking the dawn of immunology. The 19th century was characterized by rapid progress in medical science. The germ theory of disease, proposed by Louis Pasteur and later expanded by Robert Koch, revolutionized the understanding of infectious diseases and led to the development of antiseptic techniques by Joseph Lister. Alongside these microbiological advances, the first anesthetics were used, transforming surgery from a brutal craft into a more humane science. Entering the 20th century, the discovery of antibiotics began with Alexander Fleming's identification of penicillin, which had a profound impact on public health. This century also saw the establishment of structured medical education and the rise of the medical research industry, leading to accelerated advancements in various treatments and diagnostic techniques, including the development of vaccines, imaging technology, and sophisticated surgical methods. The latter part of the 20th and early 21st centuries have been marked by the increasing role of technology in medicine, including the rise of genetic engineering, biotechnology, and the Human Genome Project. These advancements offer profound insights into the genetic bases of many diseases and are leading toward more personalized medicine approaches where treatments can be tailored to individual genetic profiles. Today, modern medicine continues to evolve rapidly with the integration of artificial intelligence and machine learning, which are set to redefine diagnostics, treatment planning, and patient monitoring. Telemedicine and mobile health are becoming increasingly important, especially in remote or underserved areas, providing access to medical consultation and monitoring through digital means. As we look to the future, the history of medicine serves as a reminder of the field's evolution from mystic practices to a complex, science-based discipline that continues to grow and adapt. The ongoing challenges of global health issues, such as pandemics and chronic diseases, underscore the need for continued innovation and international cooperation in medical science, ensuring that the benefits of medical advances are accessible to all.